As we head into fall, the chances of illness increase during cold and flu season. Medical experts say vaccinations can help prevent serious illness and stop the spread. I'm here with Marla Flood, manager of maternal child health from Buckeye Health Plan, to discuss the importance of vaccinations for families. Marla, thanks for being here with us today.
Thank you for having me.
So such an important topic. Let's start with the basics. Why are vaccines important for families, especially heading into fall?
As we head into fall, we all move inside. Kids go back to school. Our celebrations move back into close quarters. Viruses love this environment to spread. So vaccines actually help prevent the spread amongst people who are in close contact. So we know that vaccines help protect us against viruses such as COVID-19, flu, and whooping cough. But they're also very important to protect our vulnerable populations, such as the elderly, our infants, babies who haven't gotten any immunizations yet, and then, of course, people with chronic conditions.
Well, that's so important to get those vaccines. So when it comes to vaccinations, there's a lot of information. How can parents feel confident about getting their kids vaccinated?
So we know that vaccines have been around since the late 1700s with the first smallpox vaccine, and they've been studied extensively throughout the years. So we know that vaccines are safe, and we know that they're effective. But having that conversation with your provider is very important to help you feel confident in the decisions you're making for yourself, your families, and your children. And it protects everyone around us, not just yourself.
Not just yourself. And so let's talk about the youngest members of the family, and really everyone in the family. We talk about immunizations, starting with babies and toddlers, also preteens and teenagers, and even to adults. So what vaccinations are important to get at every stage?
So for babies and toddlers, there's typically series of vaccines, such as the series for polio, the series for DPT, or your diphtheria, pertussis, and tetanus. So we get series all the way through typically 3 months, 6 months, 9 months, 12 months, 18 months.
All those appointments.
All those appointments, yes. And they're pretty much mostly the same vaccines. About 12 months they throw in the MMR. But then once we get to kindergarten, again, those are boosters of the same vaccines that they've had in infancy and toddler. But when we get to middle school, of course, there's typically a booster for the measles, mumps, and rubella, and a vaccine for meningitis. But also the HPV vaccine becomes available, which protects children against cancer, some cancers, in later life.
Okay. And then what about when you're an adult? Do you still need to get vaccines? As
an adult, yes, it's definitely important that you talk to your doctor what vaccines are important to you and what schedule they think you should be on. But also, as we get older, unfortunately, we do have additional vaccines that are available to us, such as the shingles vaccine. We all had chickenpox, so now we've got the shingles laying dormant. So there's a vaccine for shingles, and then also a pneumonia vaccine that's important for our elderly to keep healthy and stay away from being in the hospital.
Talk about the importance of getting a flu shot.
The flu shot is very important, especially going into fall when we know that, again, we've moved inside, we have close quarters. The flu loves that. They love to spread there. So it is particularly important that we protect ourselves and our loved ones. We know that there were over 9,000 hospitalizations in Ohio alone last year. So just getting that flu shot protects ourselves, protects our families, protects our loved ones.
That's so good to know. So how easy is it for Buckeye Medicaid members to get the flu shot or other vaccines?
Yeah, for Buckeye, it's very easy. You just go to your doctor. You can go to the local pharmacy. Some of the pharmacies do provide vaccines. Buckeye also provides transportation. So if you need transportation, you can call the number on your card and we can make arrangements for you to get there. And you also have to remember that you get rewards for going to your doctor visits and getting your immunizations.
Well, Marla, thank you so much for being here with us today, giving us all this important information on vaccinations. You guys are the experts and we appreciate you.
Thank you for having me.
For more information about immunizations, you can visit buckeyehealthplan.com/vaccinate.